Now, this is a very interesting CT scan of the brain, which has a very nice finding. So, when we zoom in, what we can see is that in this film, there is something which is very, very dense, white in structure, and on the right side of the brain. So, this is right side, and this is left side. This is left side, and this is right side. So, we know that the on the CT scan, the most dense white structure or white structure, what we call it as radio dense. So when they are dense white, we call it as radio dense. It has to be either blood or bone or calcium. So these are the three things which are very commonly radio dense. So usually blood appears as dense as the bone. So we know that this is skull. This all is skull. This all is skull, so it is appearing dense white or radio dense. And as white as this is this structure, which is blood. So obviously, how we have defined stroke is it is a sudden onset neurological deficit which is attributable to a vascular cause, and the patient present with sudden onset of weakness of something. So here what happens commonly is there is either ischemic stroke or there is hemorrhagic stroke where the patient has bleed, and this is the bleed. So it is appearing dense white. So when we notice, this is this area of the putamen. So if you can see, this is the lateral ventricle. This lateral ventricle is compressed because it is appearing very, very much compressed. This area is caudate lobe. This is the area of caudate lobe, which is a part of basal ganglia, of course. This part which we can see is thalamus. Here it is compressed. This is the thalamus, which is supplied by the posterior circulation. And this part which is here is putamen, a lens-shaped structure. This is like this. This is actually putamen and globus pallidus area. And this is the most common site of hypertensive hemorrhage. So here, this is the caudate area, this is the thalamus area, which are very well preserved, but the patient has significant bleed in this area, which is putamen and which is putamen and globus pallidus, which is the most common site for hypertensive bleed. So this is a very, very typical example of a putamenal bleed in an uncontrolled hypertensive patient with not only bleed but also the edema. Now, edema or acute ischemic stroke appear radiolucent or hypodense structures. So if you can see on this left side, this is the left side of the brain. Just notice this radio density and this radio density. So you can see that there is blackish shadow or radiolucency is there, and usually radiolucency or a blackishness on the CT scan in the brain always suggests either edema or an acute ischemic stroke. So here, as we know that there is significant bleed, there is edema around, there is accumulation of water inside these brain cells that is causing this type of radiolucency. So this is a very, very nice CT scan film showing typical hypertensive bleed, which is compressing the lateral ventricle, compressing the caudate lobe, is causing compression over thalamus. There is a very minor subtle midline shift also, if you can see, because in here the midline has to be like this, but the midline is slightly pushed towards the left side. So there is very minor subtle midline shift with lateral ventricles compression, caudate lobe compression, thalamus compression, and with marked surrounding edema. So that's all for now, and thank you.